Right now, somewhere in America, there's a medicine cabinet with a recalled pill inside it. The bottle looks completely normal. The label looks fine. And the person taking it every single morning has absolutely no idea. That's the strange truth about drug recalls. When the FDA pulls a medication, no one calls your house. No one knocks on your door. The recall happens quietly in pharmacies and warehouses, while the bottle already sitting on your shelf stays exactly where it is. In the past few months, two very common types of medication, a widely used blood pressure pill and a common antibiotic, were recalled in the United States. Millions of people take drugs just like them. So in the next few minutes, I'm going to show you exactly which ones, exactly why, and most importantly, a simple way to check whether anything in your cabinet is affected. Stay with me. This one matters. Let's start with the question that surprises almost everyone. Why didn't I hear about this? Here's the reality. When a drug is recalled, the recall goes backward through the supply chain first, to the manufacturer, the distributors, the pharmacies. They pull the affected stock. But the bottles already sold, the ones in your home, those are much harder to reach. Unless your specific pharmacy flags it and happens to call you, you may never be told at all. And here's the second thing that catches people off guard. A recall almost never means the entire medication is dangerous. It usually means something went wrong with one specific batch, what's called a lot. A labeling mistake, a manufacturing problem, or an impurity that slipped in during production. The same exact drug made in a different batch may be perfectly fine. That's actually good news because it means you don't need to panic and you don't need to stop your medication out of fear. What you need is information, the lot number, the manufacturer, and a quick way to check. And by the end of this video, you'll have all three. But first, let's look at the two recent recalls, because understanding why they happened tells you how to protect yourself. The first recall involves a blood pressure medication, a combination pill of Bisoprolol fumarate and hydrochlorothiazide. It's prescribed to enormous numbers of people because it does two jobs at once. It slows and steadies the heartbeat, and it helps the body shed excess fluid to bring blood pressure down. In late November of 2025, the manufacturer, Glenmark Pharmaceuticals, issued a voluntary recall, and the reason is genuinely unsettling. The recall was issued for possible cross-contamination. During manufacturing, there was a risk that this blood pressure pill could contain traces of a completely different drug, a cholesterol medication, that should never have been in there at all. Think about what that means. You take your pill believing you're getting one specific medicine at one specific dose. But if a different drug is mixed in, even in trace amounts, you could be taking something your doctor never prescribed, something that could interact with your other medications. Now, and this is critical, this was a voluntary recall, and it covered specific lots, not every bottle ever made. We're talking about roughly 11,000 bottles, with certain expiration dates into 2025 and 2026. That's why the lot number on your bottle matters so much, and I'll show you how to read it in a minute. If you take a blood pressure combination pill, especially one with these two ingredients, this is your signal to check. Not to stop, not to panic, to check. Because for blood pressure medication in particular, suddenly stopping can be more dangerous than the recall itself. We'll come back to that. The second recall involves a common antibiotic called erythromycin. It's been used for decades to treat all sorts of bacterial infections, and it's often given to people allergic to penicillin. In the spring of 2026, Zydus Pharmaceuticals recalled certain lots of their erythromycin tablets. And the reason is a word you may have started hearing more in the news: nitrosamines. Let me explain what that means in plain language, because it sounds scarier than it needs to. Nitrosamines are a type of impurity that can form, in tiny amounts, during the manufacturing of certain medications. They're not added on purpose. They're an unwanted byproduct. And here's why regulators take them seriously. At high enough levels, over long enough time, some nitrosamines are considered probable cancer-causing substances. But I want to be very honest here. One contaminated pill is not going to give you cancer. The concern is long-term exposure above a safety limit. The recall happens precisely because the system is working. Testing caught the impurity, and the drug was pulled as a precaution. This isn't the first time. Some of you may remember back in 2018 when the blood pressure drug valsartan was recalled for this very same reason. Each recall, while alarming sounding, is actually a sign the safety net is catching what it's supposed to catch. So the takeaway is the same for both. The system flagged a problem in specific batches. Your job is simply to find out whether one of those batches is sitting in your home. So let's get practical. Here is the exact step-by-step way to check whether any medication in your home has been recalled. Grab a pen or just watch. Step 1. Find two things on your bottle: the manufacturer's name and the lot number. The lot number is usually a string of letters and numbers, often near the expiration date. This is the single most important piece of information because recalls almost always apply to specific lots, not every bottle. Step 2. Go to the official source. In the United States, the FDA publishes every drug recall on its website. The page you want is the FDA's Recalls, Market Withdrawals, and Safety Alerts, and you can search it by drug name. There's also a more detailed database called the FDA Enforcement Reports, where you can match your exact lot number. I'll put these links in the description so you don't have to write them down. Step 3, and honestly, this is the easiest. Call your pharmacy. Your pharmacist keeps a record of everything you've filled. One phone call: has anything I'm taking been recalled recently? And they can check in minutes. Don't ever feel like you're bothering them. This is exactly their job. Step 4, sign up to be notified. This is the one almost nobody does, and it's the most powerful. The FDA offers free email alerts for recalls. You sign up once, and from then on, they email you when a recall is issued. You go from being the last to know to one of the first. 4 steps. Read your bottle, check the FDA site, call your pharmacy, sign up for alerts. That's the whole system, and now you know it better than most people ever will. Now, I need to give you the single most important rule in this entire video. If you discover that your medication has been recalled, do not simply stop taking it on your own. I know that sounds backwards. Your instinct is to throw it out immediately. But for many medications, especially heart and blood pressure drugs, stopping suddenly can be far more dangerous than the recall itself. Blood pressure can rebound, heart rhythms can be disrupted, the cure can become worse than the problem. So here's what you do instead. The moment you find a recall affects you, call your doctor or pharmacist. They will either confirm your lot is fine or arrange a safe replacement, often a different batch or brand of the very same medicine. A recall is a reason to make a phone call. It is not a reason to panic, and it is not a reason to stop cold. So let's bring it home. Two common medications, a blood pressure pill and an antibiotic, were recently recalled. Not because the entire drug is poison, but because specific batches had problems that careful testing caught. And the only thing standing between you and that information is knowing where to look. Now you do. Take 5 minutes today. Open your cabinet. Read the labels. Check the manufacturer and the lot number. And if anything looks like a match, pick up the phone before you do anything else. The recall system isn't there to scare you. It's there to protect you. But it only works if you know how to use it. And now you're one of the few who really does. If this helped you, do me one favor. Share it with someone over 60 who takes daily medication. It could genuinely matter. Subscribe so you don't miss the next one. And tell me in the comments, did you know recalls work this way? I read every reply. And remember, this is general information, not medical advice. Always talk to your own doctor or pharmacist about your specific medications. Take care of yourself. I'll see you in the next one.